Hello, today is April 30th, the end of what has felt like a very long month. And we continue to mask and shelter in place to help control the spread of the novel coronavirus. So today I have with me Peggy Gricus, who is the Vice President of Patient Care Services and has been the Chief Nursing Officer here at Silver Cross for 16 years. She's been with Silver Cross for 23 years, and Peg is also a member of the executive team. Would you be okay to take off our masks for this?
Sure.
Okay. So, Peg, first of all, let me start by congratulating you as being named in Crain's as one of the top female executives over age 50 in the Chicago area. So well deserved.
Thank you. It was a big surprise, and I'm very humbled and really proud. It's an honor.
I was delighted. So I don't see you much these days. How are you?
I'm well. I love being here. Some people say, how hard is it to be in healthcare today? And I'm like, it is such a privilege. I've always felt it's been a privilege to be a nurse. And just to be surrounded by the amazing caregivers that we have, and just to see how every department in the hospital works well together, it's just brought out even better things in us than we've ever experienced.
Wow. What's the census like today of our COVID patients?
You know what? Knock on wood. I'm really happy to say that the COVID census has gone down. So I'm hoping that that's sustainable, right? We've learned so much about how to take care of them. So if it does, go back up, we'll be prepared. But right now it's gone down very nicely. We're very happy about that for our patients and their loved ones.
We'll keep our fingers crossed that Mother's Day doesn't cause a bump.
I know, with everybody gathering.
I know. It's going to be hard for people to see their mothers, but there's good old Zoom.
That's right, good old Zoom.
So I can only imagine that you and your leadership team might be a little exhausted. Can you talk about how morale is and some of the biggest challenges you faced?
Yeah, you know what? I have been blessed with an amazing leadership team. I've always known that, but wow, this has really brought out the best in them. They have worked really tirelessly. Their biggest goal is to make sure that their caregivers have everything they need to keep themselves and their patients safe. And that's a big job. But also, they're the teachers. They're the cheerleaders. They have to really allay the concerns of the staff. And so if they keep them informed and make sure that they squelch any rumors and make sure that they're getting the right information and really give them that belief that they can do it, right? That they've got this. In fact, I can't tell you how many times I've heard that over the past probably 6 weeks is, we got this. I'm so proud of them, right? Because they instill that confidence in the staff who are scared, right? I mean, it's very challenging work. I think one of the biggest challenges has been the ever-changing symptoms that our patients are experiencing. So we're learning so much about the COVID, right? That we're every week it seems like there's a new symptom for us to be looking for. So it's never been more important to have those really keen, astute assessment skills. So making sure that our nursing staff and our doctors are picking up on those insidious signs that something may be going wrong with the patient and acting on it, right? Calling that respiratory therapist when their oxygen level gets lower, just rallying the troops and calling a rescue team, right? Because the patients are, when they're sick and they get more sick, they deteriorate quickly. So I've been so pleased with how early they're identifying those signs of deterioration. It's been so important, and again, just being their cheerleader, picking them up, they're the ones who really hold them up. Right, it's a very emotionally draining situation, even more than the physical. It's this fear, right, and this concern that are they going to miss something in that patient. So the leaders are always there to say, "You got this.
You got this.
Yeah,
you got this." Well, I know you certainly do that all the time. Lift people up, and you're the greatest cheerleader we have here.
Yeah, I never got to be a cheerleader in high school.
Well, it's a shame because you would have been a really really good one. So there have been some amazing stories over the last few weeks, extraordinary efforts, and it's nurses, it's pharmacists, it's CNAs. Can you share one or two?
Oh gosh, there's so many.
I know.
I know. Sharing one or two. So, um, again, talking about picking up signs and symptoms, right? There's been so many times where our CNAs, as an example, certainly the nurses there, the doctors are there, but the CNAs at that bedside, they often pick up a sign of something's different. They don't know how to coin it. They don't know exactly what to say, but they'll say, Mrs. Gricus, something's not just right. She's different than she was yesterday. And sure enough, they're picking up those little clues. So they're such an integral part of our team, right? The pharmacist, as an example, because of so many patients initially needed to be on ventilators, there was a shortage nationally of medications to keep them sedated and to make sure that they're responding well to the ventilation. And so they came up with, working with the doctors, they came up with this list of alternative drugs that could be used in case we couldn't get the supplies that we needed. And being proactive, and honestly, I have to honestly say, that's what our theme is at Silver Cross. We are proactive.
Right.
We don't like to be reactive. So in a proactive way, I think it warded off the shortage because we never got to a point where we didn't have what was needed for those patients. We just have amazing pharmacists and the people that actually, secure the drugs for us and buy the drugs. It's just been terrific. Also, like pharmacists, there is such a need to conserve protective equipment, right, PPE. So they work together with nursing and the doctors to cluster the medications. So the goal was not to go into the patient's room any more than you really needed to, because you didn't, every time you go in and out of the room, you use more PPE.
And you have to
don and you have to
and then you put on a whole new set.
A whole new set every time. So they decided if they could effectively cluster the medications so that the nurse could only have to go in certain times instead of every 4 hours, maybe it's every 6 hours. And they worked with the doctors and the nurses, and they came up with a schedule of medication administration that decreased the amount of times they had to go into the room.
That's really
It was really very cool. Yeah.
And I understand in some cases the nurses are also able to communicate with patients via their cell phones.
Oh my gosh, that's been so amazing, right? So at the beginning, it was like, okay, well, how are we going to help them, right? So how are we going to leverage technology to be that conduit of communication? So right away, the nurses are like, oh, I got this. I'm just going to use my phone. So they would be with the patient who, it's so sad because they don't have their loved ones there. And so the nurse doesn't hesitate to do FaceTime with their family. And then IT, they said, well, we want to help too. So IT got us tablets, and they literally have set up WebExes. So now the patient can see a bigger picture of their loved ones at home who are so worried. It's been really just heartening just to know how much they're giving of themselves, right? There are so many caregivers that have just not even taken their meal breaks because they have so many calls to make from families, because families aren't there, right? So they leave messages, please call me about my mom, my dad, or whatever. And the nurses are like, oh, I can't eat until I make these phone calls, or I can't go home until I make these phone calls. So selfless, right?
Very much
and even doctors, they've been, we've always had a great rapport, relationship with our doctors. But again, everybody was so mindful of not going into the room any more than you really had to keep the patient safe. So while the doctors are in there, and the nurse is not with them, if the patient had to be toileted, the doctors were toileting patients. The nurse practitioners were toileting patients, helping them turn in their bed. Because they were like, I got this. Right. You don't have to come in.
So this has brought out the best in teamwork and how people support each other, which is all part of our safety habits.
Absolutely.
But good thing we had all that ingrained, and it's
it
really remarkable. So can you tell people what your thoughts are about coming to the hospital? Are we safe here? If somebody's experiencing chest pain or belly pain that's really acute, what do you advise them
Oh
to
my
do?
gosh, we have heard stories. In fact, we've witnessed a couple stories where patients have waited too long to come to the hospital because they're scared. They're afraid that they may, get COVID while they're here. We are very prepared. We have all the supplies that we need to keep ourselves and them safe. We have all the protective equipment. In fact, I have to give kudos to Meg, who's our director of purchasing. We have never run out of anything that we needed to keep our patients and our staff safe. But we know how to take care of you. We've got the skill set for you. We've got the talent here. We've got everything that you need to get better here. So don't miss an opportunity to come in and let us care for you before something worse happens.
Right.
So,
One of the surgeons was telling me this week that a patient waited for a very long time with belly pain and ended up having an infected gallbladder.
Right.
It wasn't necessary.
No.
And our COVID patients are isolated from other patients.
They are.
Same thing in the emergency department. We have
Correct.
negative
From the
pressure
moment they
rooms.
come in, they're isolated.
Right.
So they don't, and we're very mindful of separating, patients and, for sure they're not intermingled.
Right.
They're in isolation rooms, and we have very strict isolation precautions that we adhere to.
Right. So, anything you would like to say to your team? And
Oh, I've just never
next
been...
week is Nurses
I
Week.
know, right? I've never been more proud of the whole team. I've said in my 46-year career that, we as nurses and physicians have the privilege of being at the bedside with patients, right? But we could never do what we do without everybody else.
Well, thank you, Peggy. Thank you for your leadership and guiding us through this. You've just done a remarkable job. Thank you.
Thank you.